Thank you. We are moving to the third story, which is the third wave we are uh, listening now. So, how likely the third wave in India, and is it knocking at the door, or can we evade that?
Okay, third wave, this is actually, this pandemic, the experience of pandemic is limited with us. 100 years back, we have a Spanish flu pandemic, and we have seen actually there is third, fourth, fifth wave. But you have to remember, at that time, we don't have vaccinations. So whenever a pandemic starts, the pandemic hits in a fashion. So in the first wave, some population will get affected. Then a second wave, some other group of population will be affected. Then there will be more mutation. Then third, fourth, fifth, sixth wave, and gradually it will be endemic kind of thing. But with vaccination, now your major populations are protected who are above 18 or maybe above 25 years. So the rest of the population who are not vaccinated, and the COVID virus is still within your premises or within your environment. So we are suspecting that these non-vaccinated group of population, like young kids and school-going children, probably the third wave may hit them, but it is not sure.
Okay.
In the first wave or second wave, we have seen that the, the children are mainly spared, and only maybe 0.1%, even less than 0.1% has got any severe illness due to COVID. So with that background knowledge, I think third wave will not be a big boom. Third wave will be there, but it will not worse like your second wave or like that.
In it will be in a controllable manner,
Because
controlled way.
major population in most of the countries are vaccinated now by I think 21 December, and if we can plan and open gradually all these schools and everything, then I don't think the third will be a very big hit.
Okay. Okay. As we knew that in Spanish flu also there were sixth wave, even seventh wave, but it was gradually deteriorating. So in this case of COVID-19 infection, it will be there COVID throughout our lifetime, or it will be eradicated completely after some certain time span, like 2 years or 3 years, or we have to live with it.
So whenever there is a new virus, and you see this virus is unique kind of virus, actually the rapidity of its spread and the severity, and that is the problem. So as much we vaccinate the entire population, I think the virus will be there, but probably the severity will be much more lesser.
Okay. Okay.
The vaccine cannot prevent you to get that infection,
Mm-hmm.
and probably if the bats and all these things are not reservoir of this infection, and only human are the reservoir of this infection, and if you can vaccinate and gradually all these children and all this population develop their herd immunity, so maybe by 7, 8 or 10 years period of time, we will have a specific medication for this virus also, like we have some medication for herpes virus or HIV and all these things. So
Okay.
we all forget about this COVID after 5 or 6 years, and maybe we will talk about some other viruses. It could be some other viruses. It could be some lab leak viruses. We don't know, but it will be there. Like
Okay.
all other viruses, one it is there in the universe. It will be there. You cannot eradicate. It is not possible to
Okay.
eradicate.
Okay. Okay. So the next one. The currently available vaccines, whether it can protect the future variants of COVID-19 virus variants, like what our science says till now, the vaccination science, or we have
Uh,
to develop some new vaccines.
So this is only future can tell you about that. So
Okay.
at present, what I can share with you that there is a disease which is a swine flu. So
Mhm.
swine flu affects a particular segment in a particular country, and after that, we know that this is a very fatal kind of illness, and all persons should get a flu shot yearly. So nowadays, most of the person who are having respiratory illness or chronic bronchitis with a pregnant patient or any high risk patient on dialysis, patients who are traveling frequently abroad, they all get their flu shot yearly.
Mhm.
So in the same fashion, you will get a COVID shot probably yearly or 2 yearly. So the vaccine will be there, and you will be with this vaccine for maybe another 10 years or 15 years until and unless there will be a major outbreak in a particular segment. Now, the mutation of the virus is a natural process, as well as you can produce a mutant virus in a lab with your research. So, if it is a natural process of mutation,
Mhm.
so the scientist or researcher will pick up it. So this kind of mutation happen in the gene, and accordingly they will design and they will develop a vaccine by another 6 months. So it will not be a very difficult job. If you will get a vaccine within 1 year after this pandemic, you will get a vaccine for the mutant variant also. So whether the present vaccine will work or not, we should not discuss, because the present vaccine is actually introduced in a hurry just to save major population, so that less person will get severe illness. So with the period of time, we'll develop much more safer and efficacious vaccine in long run. I hope all the mutations along the mutant variants will be covered in those newer batch of vaccine.
Okay. Okay. Okay, so the next one is the oral medication development. So we have heard that DRDO has developed that oral medication for COVID-19. So how efficient it is and whether it is coming in the market for mass population.
It is actually a drug, whatever you know, the 2DG. It is actually a drug which was used in a cancer patient. So uh, this cell, whenever the cell is affected by virus or cell is affected by any chemical agents or any cancer cell, there is propensity to lyse, so it will break down. It is called it is called apoptosis. So the ultimately cell will die. So these drugs actually uh, work in a place of cell cycling. So the cell cycling will be there. When the cell, from one cell you will get a two cell, from two cell you will get a four cell. So there is a process of cell division, and there is a half-life of a particular cell. So this 2DG will probably, according to research, they will prevent lysis or immature or premature death of a COVID affected cell. That is the essence.
Okay.
So it is only trialed in case of severe illness and oxygen requiring patients. So it is still not available for mild illness, and it is probably only available for in-hospital use. And the hospital stay is shortened by use of 2DG, and oxygen requirement is also shortened. And suppose the patient is requiring 8 liter oxygen, with 2DG the requirement drops down to 4 liter or 50% lesser. So that is the
Okay.
essence. Whether it is directly related to any mortality benefit or more person on 2DG will be saved, still we need
Mhm.
much more research. Still we need much more
Okay.
research.
Okay. Okay.